Hey everyone, welcome back to the channel. If you're new here, I'm glad you found us. This is your go-to space for everything related to Canadian immigration, especially for skilled professionals like you. Now let's dive into something that could change your life. What if I told you that even with a low CRS score, you could still become a permanent resident in Canada? Thanks to a little-known immigration pathway designed specifically for healthcare professionals. If you're a doctor, nurse, midwife, or allied health worker dreaming of settling in British Columbia, this could be your golden ticket. In this video, I'm going to reveal how the BC PNP Health Authority stream works, why it's one of the most reliable routes to PR in 2025, and how you can take advantage of it, whether you're eligible for express entry or not. The Health Authority stream under BC PNP is designed specifically for healthcare professionals working in BC's public health system. This includes doctors, nurses, midwives, and certain allied health professionals. While many people think all PNP streams require a job offer, the Health Authority stream is slightly different in how it handles this requirement. Yes, you still need a job, but it must be with one of BC's recognized health authorities, which are government-funded. That means the employer is already pre-approved by the province, so the process is much simpler than for private employers. However, it's important to note that employer support is still mandatory for all applicants. As of April 2025, there have been some major changes to this stream. Due to federal reductions in nomination allocations, BC PNP has capped the number of new applications for the year at 1,100. This means competition is tighter, and not all eligible candidates will be able to apply. Additionally, eligibility for the Health Authority stream has been narrowed to frontline healthcare roles only. Support and administrative positions, such as clerks, dietary aides, housekeepers, and security officers, are no longer eligible. Only those who directly deliver healthcare services can apply, including physicians, nurses, nurse aides, midwives, pharmacists, psychologists, social workers, physiotherapists, respiratory therapists, lab and radiation technologists, dentists, and veterinarians. Now, let's talk about the two pathways you can use to apply for BC PNP under the Health Authority stream. The first is the Skills Immigration Pathway and the second is the Express Entry BC Pathway. Both require a valid job offer, but the main difference lies in what happens after you receive the provincial nomination. Skills Immigration is a direct provincial pathway. You apply straight to BC PNP, and if you're nominated, you submit a paper-based permanent residency application to IRCC. Because this pathway isn't connected to federal express entry, your CRS score doesn't matter. In fact, skills immigration can be particularly advantageous for people who have a low CRS score or don't meet express entry eligibility criteria. Even if your profile wouldn't get an invitation to apply through federal express entry, you can still get a provincial nomination and apply for PR through skills immigration. When applying under Skills Immigration for the Health Authority stream, your eligibility is assessed using BC's Skills Immigration Points system. The maximum score a candidate can achieve is 200 points, with points awarded for factors like education, work experience, language ability, and the job offer itself. In recent 2025 draws, the minimum score required to receive an invitation to apply for this stream has been around 150 points. Your language ability, typically CLB 7 or higher, and having a valid, full-time job with a BC Health Authority are critical components in meeting this threshold. The downside of this pathway is that processing is slower, usually taking about 15 to 19 months. On the other hand, Express Entry BC is linked directly to the Federal Express Entry system. To apply through this pathway, you must first have an active Federal Express Entry profile and qualify under one of the federal programs, such as the Federal Skilled Worker Program or Canadian Experience Class. Once your Federal Express Entry profile is active, you can submit an application to BC PNP under Express Entry BC with a valid job offer in the Health Authority stream. If BC nominates you, the provincial nomination is automatically applied to your Federal Express entry profile, giving you 600 additional CRS points. This almost guarantees that you will receive an invitation to apply in the next Federal Express entry draw. After receiving the invitation to apply, you submit your PR application online to IRCC, which is significantly faster than the paper-based skills immigration route, often taking just 6 to 8 months. So in simple terms, both pathways require a job offer, but skills immigration is slower, paper-based, evaluated on a provincial points system with a maximum of 200 points, and does not depend on your CRS score. Express Entry BC, on the other hand, is faster, online, requires Federal Express entry eligibility, and automatically boosts your CRS score by 600 points when you receive a provincial nomination, making an invitation to apply almost certain. In short, if you have a low CRS score or don't meet express entry criteria, skills immigration is a valuable option. But if you are eligible for express entry BC is usually the better choice because it's faster and almost guarantees an invitation to apply once you receive the provincial nomination. Either way, the Health Authority stream remains one of the most reliable pathways for healthcare workers to secure permanent residency in BC in 2025. Just make sure your occupation is on the updated list and that you apply before the annual cap is reached. If you found this explanation helpful, hit the like button, subscribe for more updates on Canadian immigration, and leave your questions in the comments. I'll make sure to guide you through every step. Thanks for watching.